If you're a man over 60, I want you to take a deep breath. This next hour might just be one of the most important conversations you've had in years. Not with your doctor, not with your spouse, but with yourself. Because today, we're diving into a topic that's rarely talked about openly, but quietly affects millions of men across the world. Masturbation after 60. The hidden risks, the surprising benefits, and the honest truth. I'm Dr. Mark Stevens. For over 30 years, I've worked with older men just like you, helping them restore energy, intimacy, and purpose. And I can tell you, most men don't truly understand how their private habits are quietly shaping their health, their hormones, and even their hearts. This isn't about guilt. This isn't about judgment. This is about understanding your body, respecting your experience, and reclaiming your strength in a time of life when so many feel invisible. In this video, we'll walk through 10 hidden risks of regular masturbation after 60, how it affects your erections, energy, emotions, and brain when it becomes harmful, and how to turn it into something healing. Plus, I'll share a simple 7-second technique that's helped hundreds of my patients restore their vitality without medication or surgery. So if you've ever felt confused, ashamed, or unsure about your body, this isn't just for you, this is about you. Let's begin. Masturbation. More than just physical. Masturbation is often seen as something purely physical, but what I've learned over the decades is this. It's emotional, it's psychological, it's even spiritual. For many men, especially after retirement or after losing a partner, or even just after the kids have moved out and the house gets quieter, that private moment becomes something more, a release, a comfort, a ritual. But here's the question we rarely ask. Is this habit helping you or slowly taking something away? That's where our journey starts, with the first hidden risk. 1. Social isolation. You see, many older men slowly begin replacing intimacy with routine, not because they're lazy or weak or broken, but because it's easier. I once sat with a 68-year-old retired teacher. He said, "Doc, I haven't touched another person in months, but I still take care of myself. That bad?" I looked at him and said, "It's not bad, but it might be lonely, because when solo pleasure becomes the only connection you experience, your world begins to shrink, not overnight, but slowly, silently, day by day. You stop calling friends, you avoid meeting new people, you stop believing that anyone wants what you still have to give." Masturbation isn't the villain here, but when it replaces hugs, laughter, and intimacy, it becomes a quiet wall between you and the world. The solution? Start small. Call an old friend, join a walking group, smile at someone in the store. Connection is still possible, even at 60, even at 90. 2. Skin micro lesions. Let's talk physical. As men age, their skin, especially around the penis, becomes thinner, more fragile. Years of friction, especially without lubrication or using too much pressure, can cause micro tears in the skin. You may not feel it at first, just a little redness, a little sting, but over time, it leads to irritation, reduced sensitivity, and even infection. It's not that masturbation is wrong, but the way you're doing it may not suit your aging skin anymore. So what do I recommend? Use a good water-based lubricant. Be gentle, not rushed. Slow down. This isn't a race, I tell every man. You're not 25 anymore, and that's a blessing, because now you get to explore better pleasure, not just faster. 3. Desensitization. This one is sneaky. A 65-year-old man once told me, "Doc, I can still do it alone, but with my wife, it's different. I don't feel much anymore." That's not unusual. When you touch yourself the same way, same grip, same rhythm, same fantasy, over and over, your brain starts linking pleasure only with that pattern. It's like training your brain to respond to just one track and ignoring everything else. With time, real intimacy doesn't hit the same. It feels dull, numb, like something's missing. But the good news, you can reverse it. How? Change your rhythm. Loosen your grip. Use your imagination instead of screens. Slow down and reconnect. Your nervous system isn't broken. It's just trained in one direction. And like any habit, it can be retrained. 4. Masking erectile dysfunction. This one's more common than most men realize and more dangerous if ignored. A 67-year-old man once told me, "I can get hard when I'm alone, but not with my wife, so I stopped trying." It wasn't that he had no drive, it's that he didn't know what his body was trying to tell him. See, when you can perform solo but struggle with a partner, that's not just in your head. It could be an early sign of something deeper. Poor blood flow, hormonal imbalance, nerve decline, even early-stage heart disease or diabetes. The penis, believe it or not, is like a health dashboard. It's often the first place you'll notice something's wrong inside, long before other symptoms show up. And because solo play is easier, mentally and physically, many men overlook the red flags. They think, I'm still working fine alone, so it's not serious. But here's the truth, it is serious, and it's treatable. If you're noticing changes and weaker erections, shorter duration, or no arousal with a partner, don't ignore it. Don't hide behind solo habits. Go see your doctor, get your blood checked, talk honestly. You don't need to suffer in silence. Real strength isn't hiding pain, it's seeking answers. 5. Nerve compression from poor posture. Now this one caught many men by surprise. Even me when I first started seeing it. An otherwise healthy 70-year-old came into my office complaining of numbness down there. No pain, just a strange, buzzing, dull sensation. Turns out it wasn't circulation, it wasn't hormones, it was how he'd been sitting. As we age, we tend to sit more in recliners, office chairs, hunched over with phones or laptops, and if you're sitting for long periods, especially during masturbation, you can slowly compress a key nerve called the pudendal nerve. This nerve controls sensation in the penis, pelvic floor, and perineum. Pressure on it over time leads to numbness, tingling, and even erectile issues. And the worst part? Most men blame hormones when it's just their chair. The fix is simple. Avoid hard surfaces or slouched positions. Masturbate lying down or reclined. Place a pillow under your knees for support. Take breaks during the day to stretch and move. When you care about your position, you're protecting your future pleasure. Small changes, big difference. 6. Using masturbation as your only emotional outlet. Let's be honest, Johnny. For a lot of older men, especially those who are single, widowed, or live alone, masturbation becomes more than release. It becomes relief. It's a quick way to deal with stress, boredom, loneliness, even sadness, and for a while, it works. The brain releases dopamine, oxytocin, you feel relaxed, even loved. But over time, if this becomes the only emotional outlet, it starts to rob you of the deeper healing you really need. You skip phone calls, you stop going out, you say no to plans, because this becomes easier than facing your feeling. That's when it becomes a quiet addiction, not to sex, but to numbing. And here's what I tell every man I work with. You don't need to stop, you just need to expand. Masturbation is fine, but it can't be the only tool in your emotional toolkit. Add other tools. Go for walks, journal, call a friend, talk to a therapist, find new hobbies, volunteer, or join a group. Because no matter how good a release feels, it's not a substitute for real connection, conversation, and purpose. You deserve more than just a moment of relief. You deserve peace. 7. Guilt and shame. This one runs deep. A retired pastor once told me, "Doc, I still do it, but afterward I feel ashamed. Like I failed." And I knew exactly what he meant, because for many men raised in strict homes, religious, cultural, or conservative, masturbation was taught as something dirty, sinful, or weak. That message lingers even decades later. So now, at 60 or 70, when a man touches himself, he feels good for a minute, then bad for hours. That guilt isn't from the body, it's from the past, and it's time to challenge it. There is nothing weak about needing comfort. There is nothing dirty about feeling desire. There is nothing sinful about caring for your body, especially after years of stress, loss, or sacrifice. You are not broken. You're human. Shame is like rust. It builds slowly and eats away at your self-image. But you can let it go. You can rewrite the story. Instead of, "I'm wrong for this," try, "I'm learning about my body and honoring my needs." 8. Hormonal imbalance from overstimulation. Many men are surprised when I say this. Masturbation affects your hormones, not just testosterone, but a whole range of chemical messengers that control mood, sleep, energy, and drive. Here's what happens. Every time you climax, your body releases a mix of hormones: dopamine, oxytocin, prolactin, and cortisol. In moderation, these are great. They help regulate stress, create calm, and promote sleep. But when release becomes too frequent, especially without emotional connection, your system can get out of balance. Your dopamine receptors become less sensitive. Prolactin levels stay elevated, lowering desire. And testosterone, it may drop over time due to constant drain. Some men notice lack of motivation, mood swings, irritability, low energy, a foggy mind, a dip in self-esteem. That's why I recommend this golden rule. Focus on quality, not quantity. If you find yourself doing it out of boredom or habit, pause and ask, am I truly enjoying this or just distracting myself? Try spacing out your release. Give your hormones time to reset, especially if you've been feeling off. Your body is smarter than you think. It doesn't just want pleasure, it wants balance. 9. Addiction to stimulation, not intimacy. This one is important, especially in the digital age. I've worked with dozens of older men who told me they never had trouble with masturbation in the past, until they started relying on internet content. The issue isn't just porn, it's dopamine addiction. When your brain gets used to quick, intense, artificial stimulation, real-life connection starts to feel dull. Your partner's touch may not excite you anymore. Your own imagination feels flat. Even memory-based arousal becomes harder. Why? Because your brain has been flooded with unrealistic images, sounds, and fantasies, so real intimacy starts to feel underwhelming. I'm not judging anyone's choices, but if your arousal depends only on digital content, it may be time to take a step back. Try this for 7 days. No screens, no fantasy, just presence, slow, mindful touch, breathing, awareness, connection to your body. You might be surprised by how much more sensitive, alive, and connected you feel. Sometimes it's not more stimulation we need, it's less distraction. 10. Loss of purpose. This one hurts my heart the most. I've seen men who were once leaders, business owners, veterans, community mentors, now sit alone in silence, not because they're old, but because they've lost a sense of mission. And for some, masturbation becomes a daily escape from that emptiness. It gives structure, it gives sensation, it gives just enough to feel something. But here's what I tell them. You are not done yet. Your wisdom, your voice, your presence, they still matter. You are not just a man who used to be strong. You are still strong. You are still needed. If you find yourself using pleasure to fill time, it might be time to fill your life with something more lasting. Mentor someone, start a small project, grow a garden, help a neighbor, write letters to your grandkids, share your story, teach a younger man what no one taught you. Masturbation is not wrong, but when it replaces purpose, it becomes a prison. Freedom comes from knowing that your life still carries weight, even if no one says it out loud. So let me say it to you right now. You matter. You still matter. Now, let's talk solutions. How to masturbate healthily after 60. We've talked about the risks. Now let's shift gears and talk about healthy, healing, respectful self-pleasure. Because yes, it can be part of your well-being, if done right. Here are 7 tips I give my patients. 1. Use lubrication. Protect your skin and preserve sensitivity. 2. Change your environment. Don't do it in rushed, stressful settings. Create calm. 3. Switch up your routine. Vary grip, speed, fantasy. Train the brain to respond flexibly. 4. Limit screen use. Use memory or imagination when you can. Rebuild natural sensitivity. 5. Don't rush. Make it about connection, not completion. Think slow, mindful, and intentional. 6. Respect your emotions. If you're doing it to numb something, pause. Ask yourself what you really need. 7. Watch for warning signs. If you're feeling disconnected, numb, or addicted, seek support. Talk to someone. There is no shame in healing. Let's recap. You're not alone and you're not broken. So let's take a moment, you and me. If you've made it this far, that tells me something very important. You care about your body. You're willing to look honestly at yourself. And most importantly, you still believe there's more life ahead of you. That's powerful, Johnny. That's not weakness, that's strength. We've covered the 10 silent risks of masturbation after 60, how it affects your physical, emotional, and hormonal health, how guilt, habit, and overuse can lead to problems, and how to reclaim pleasure as something positive, not shameful. Now let's end with something practical, a powerful, natural tool I give to many of my patients, something you can start using today. The 7-second pelvic power technique to restore blood flow, sensitivity, and control. This simple practice helps improve pelvic circulation, stimulate testosterone, and strengthen the muscles responsible for erections, all without pills. Here's how it works. 1. Sit or lie down comfortably. Relax your shoulders and lower your back. Breathe naturally. 2. Focus your attention on the area between your anus and scrotum. This is your pelvic floor. 3. Now gently squeeze that area like you're trying to stop urine midstream. Not your stomach, not your thighs, just that deep internal squeeze. 4. Hold it for 7 seconds. Breathe calmly. Focus on the tension. 5. Release slowly. Let the muscles fully relax. 6. Repeat this 5 times in a row, 3 times a day. That's it. Over time, this improves blood flow, to the penis erection, quality bladder-controlled sexual confidence, and even emotional calm. It's like lifting weights for your manhood silently, safely, and naturally. No side effects, no embarrassment, just 7 seconds of control. That rewires your health from the inside out. My final message to you, Johnny, listen to me closely. You are not too old. You are not too far gone. You are not just a number, a diagnosis, or a fading memory. You're a man with years behind you, but also years ahead. And those years deserve joy, intimacy, purpose, and peace. Masturbation is not your enemy, but it should never become your escape, your addiction, or your replacement for connection. Start small, make adjustments, and above all, treat your body like something sacred, not something shameful. You deserve real connection with yourself and with others. And if no one else has told you today, you still matter. You are still powerful, and your best days are still ahead. Take care of yourself, and I'll see you in the next session. If you like this video, don't forget to subscribe to the channel, and I'll see you in the next one.